Good afternoon, everybody. It is a pleasure to be here, and it's fantastic to speak on behalf of myself and Health Navigator to all of you, and to listen to all these expert speakers here today as well. Today, my presentation will be on the structure of a digital health encounter. And during this time together, we're going to talk about tools for enhancing the provider and patient experience. And we're going to talk about health bots, we're going to talk about natural language understanding, we're going to talk about symptom checkers. And the way that we're going to approach this is first I'm going to give you a little bit of introduction, then we're going to talk a little bit about the structure of Health Navigator and how we work, and then I've got several case studies that I want to share with you of work that we've done with a number of partners. First, some background, as our kind facilitator shared with you. My background is actually emergency medicine and engineering. So I've been a practicing emergency physician for close to 30 years, and I still see patients and still enjoy patient care after all this time, despite the changes of technology and healthcare. I work at Northwestern Memorial Hospital in Chicago. I've been involved in clinical informatics and telehealth for over 20 years. Myself and my partner, Dr. Barton Schmidt, we provide the telephone triage guidelines that are used in nurse advice lines in probably 95% of the call centers in the United States and in Canada. And I've also been involved with clinical informatics, medical coding, and physician documentation. Several years ago, served as a CIO for Schumacher Clinical Partners, where we had close to 8,000 physicians taking care of patients across 400 different hospitals. Let's shift gears here a little bit and talk about Health Navigator and what we do. Today, we've heard a lot of different companies talk about their platforms and their software. Health Navigator, while I'm going to show you some software today, we're actually a content company. So we're not the pipes, we're the water in the pipes. We're not the car, we're the engine inside the car. And so we provide artificial intelligence and decision support tools, which we've curated over the last 20 years, and we license that content through web services delivered as an application programming interface to our partners. And then we pride ourselves on the support in terms of working with our partners to deliver solutions that really make care better for patients and enhance care for physicians and nurses and other healthcare providers. The type of problems that we face or help with are problems around the patient and provider experience. We have a reason for visit vocabulary that I'm really quite proud of. We work in documentation and decision support. And we work in the area of patient education, which is really key, I think. And the type of solutions that we work on, well, we actually work in 4 main different areas. First, down here at the lower left, we work with nurse advice lines, also called medical call centers. And in this space here, we do things like natural language processing. One of our clients, Centene Corporation, uses our natural language processing engine on 250,000 patients a year to transcribe and translate the patient's free text utterances into data. And then we use that as the starting point for the medical call center encounter. We also work with telemedicine companies, including MD Live and CarePort MD and Pager. And I'm actually going to give a couple presentations and case studies about those. We work with a number of different companies in the health bot space. Microsoft, if you go online and do a search on Microsoft and Health Navigator, you'll see a health bot that's actually powered behind the scenes by Health Navigator content. We're now working in many different countries across the world. And at this point, I actually want to switch gears completely again and actually talk about things a little bit more from a clinical standpoint. And I'm going to talk about the medical encounter, and I want each of you, for just a moment, to imagine the last time you saw a doctor, whether you wanted to or not. So you went in with a cough or a sore throat or something like that. And I want to paint the picture that the structure of any medical encounter really has a beginning, a middle, and the end. There's a beginning in which the doctor asks you, tell me what's wrong today. What's bothering you the most? What symptoms are you having? And you may respond that I've got a cough and I've got a runny nose. And we refer to those as the chief complaint, and you may have a primary chief complaint and a secondary chief complaint. There's a middle of the encounter in which the doctor then asks you follow-up questions or tell us more questions. And he may say things like, or she may say things like, how long have you had the cough? How bad is the cough? Do you have shortness of breath? Do you have a history of asthma? Do you smoke cigarettes? And we call that the middle of the encounter. And then there's an end of every medical encounter when you see your doctor, in which he or she makes some decisions about whether or not a specific treatment is necessary, whether you need a prescription, whether you need to have a test or other tests done. So that's the typical medical flow. And what we've done with Health Navigator is we've tried to replicate that medical encounter from beginning through end. So looking at the slide up here on the screen, what we've tried to do is we've got a clinical vocabulary that joins everything together, that's coded with SNOMED. We have natural language processing, which allows us to understand the beginning of the encounter. We have anatomic navigation and other ways to look up the chief complaint. We have documentation support in the middle of the encounter so that we can actually generate 487 different dynamic checklists that actually engage with the patient in 10 different languages, so we can actually ask and interview questions in an automated way. And then we have tools for triage, which is sorting patients to the right level of care. We have a diagnosis engine, which can actually generate lists of possible causes. We have care advice and other resources. So here's the same workflow in a typical symptom checker type encounter. So if you go onto a symptom checker website or a HealthBot website or the Microsoft website, what you'll see is a workflow that at a very high level looks just like this. And specifically, we start off with a chief complaint. So what is your main problem? We ask questions about that chief complaint that are relevant. We factor in age and gender and pregnancy status. And then we can do one of three things. We can calculate a triage score, we can generate care advice, or generate a list of likely causes. If you think about what patients want when they go on the internet, for example, if they go into Dr. Google, what are the three things that they're really interested in? Number one, they're interested in, do I need to see the doctor? And how quickly do I need to see the doctor? Number two, they're asking, what are the possible causes of my symptoms? And number three, what is simple, safe care advice that I can use at home until I see the doctor? So that's the space that we work in, and that's the space in terms of the content that we license. This slide here just kind of reminds me to say that everything we do is digital. So while I've talked about the patient, and I've talked about this information that we deliver, we actually deliver all the information through either XML or JSON, and so we actually deliver it to our partners who then use it and show it within their applications. Every medical encounter has a beginning, and we started talking a little bit about that, but for us, the beginning is a core and foundational piece. And the reason why it's a beginning, because it's the pivot point, it's the start for every single medical encounter. So eliciting the patient's presenting complaint is one of the first tasks of a health personnel. And so we want to identify what their reason for visit is, why they're seeing the doctor, why they want to talk with the nurse. And as part of this, we've actually developed a clinical vocabulary around this that allows us to identify 487 different potential chief complaints as starting points for a digital health encounter. Here's a snapshot of what I'm talking about here today. On the screen, here's a list of possible chief complaints along the left-hand side there. And if we look at, for example, a chief complaint like ankle pain, that's actually separate and different than ankle redness, different than ankle swelling, different than ankle injury. And if you communicated those to a doctor, he would consider those mutually exclusive, and we'd actually process that patient's care in a different way. And in our system, since we do everything from a data standpoint, ankle pain has metadata. So it has metadata for type, it's a symptom. It has metadata for what part of the body system, it's musculoskeletal. It has ICD-10 data, SNOMED coding data, and other acuity data as well. So that as a patient proceeds through this digital health encounter, we're not just gathering text, but we're actually gathering data so we can actually capture that information and potentially use it and leverage it in other ways. This just reminds me to say that we do this in Spanish, and 10 different languages. And we just recently translated into Norwegian as well, and these are chief complaints in Norwegian. This chief complaint vocabulary is actually part of a larger clinical vocabulary, because for the clinicians in the room, that you know there's a dynamic interaction between a chief complaint and possible diseases and conditions. For every chief complaint, like cough, there may be 70 or 80 possible causes of cough. And vice versa, for a disease like influenza, there's certain symptoms. And that relationship can actually be captured in a database, in a relational database. Let's change gears one more time now. What I'd like to do now is move into some case studies of partners of health navigators that are using this content to make a difference. And the first case study is actually a company called MD Live, which is actually based out of the United States, and they provide telemedicine care to every state in the United States. And they're typical, this year they'll probably hit 500,000 patients. And so when I say 500,000 patients, that means a doctor is talking to a patient on the phone or via video 500,000 times a year. The head of MD Live is Dr. Lyle Berkowitz and Rich Berner. And this just shows you how they're using some of our tools as part of what they do. So they've embedded our vocabulary within their platform so they can actually understand the analytics. And in this particular data set, we just simply asked for 454,000 patients over the last 12 months, what are the top reasons why a patient calls in to speak with a doctor and get help? And for pediatric patients, the top reasons, of course, things like throat pain, cough, fever, ear pain, nose stuffiness. And for adults, it's curiously the same: cough, nose stuffiness, and throat pain. And so by using a vocabulary like this, they're actually able to identify the reason for visit and actually start the process through the telemedicine visit. The other thing we've done with MD Live is that we actually have a diagnosis engine, which they have access to, and we asked a question: what percentage of the time does Health Navigator accurately predict the diagnoses that a doctor gives to a chart? And for this, using de-identified data, we looked at a sample of 12,000 records, and coders went through and compared the doctor's diagnosis to the Health Navigator diagnosis, and 95% of the time, we were able to predict what the doctor was going to diagnose. I'm actually going to move to my home city, which is Chicago, and this is a new company. So MD Live has been around for 4 or 5 years. Lytic's been around for about 1 year. And the group there is actually building a software program called Checkup. And this is an omnichannel health bot that they've built that captures information using Health Navigator tools for both the natural language processing, asking the patient more questions, and then providing triage recommendations as well. And what they do at the end of the encounter is they roll all that information up as medical data, and they can actually send it to a doctor for review and follow-up. I'm actually going to move down to Africa, and these are two extremely bright and innovative gentlemen. One's name is Dr. Davis Muzunguzi, and the other is Dr. John Mark Bonica, and I met them about 9 months ago at the American Telemedicine Association. And they've done something unique. And what is that? Well, in Uganda, people do not have landlines. Many people do not have computers, but many people do have mobile phones, and many people do have Facebook as well. So they've actually built a health bot using Facebook Messenger that asks patients questions, automatically gathers that information, and then passes it on to a doctor. The name of their application, and you can do a search on this, is called Mirembe, and it means peace of mind. And if we look at some screenshots from their application, you can see this health bot here, which is actually built on Facebook Messenger, where the patient puts in something like "my head hurts," and then the natural language processing engine actually translates this and recognizes this as head pain. And then we ask some questions in follow-up. Questions just like a doctor might, but we try to do it in as plain language as possible. And so we ask, how bad is the headache? How long have you had the headache? What other symptoms do you have? And we capture this information. Over here on this screen, you can see that at the end of this checkup, you can actually print out a report of your encounter, or you can even request a callback from one of the doctors who's actually sitting in their call center. Now, this is where they do something that's really quite cool. So what they do is that they then turn this into an intake checklist for the doctors to call back. So these are a list of 4 hypothetical patients in which these patients have called in, and they're now in queue for the doctor to call back after they use the Mirembe app. And the doctor calls them back, and at the same time, up on the screen, all the information that the patient put in before is pre-populated into the electronic patient record to save the doctor time. The doctor validates the information, asks additional questions as necessary, and provides a recommended treatment plan and diagnoses. The other thing that we actually help them with, and you can see this over here, is that we provide decision support. And we take the chief complaint, we take the patient's age and gender and pregnancy status, we take the answers to all those questions, and then we actually generate a list of possible causes based on those clinical findings, and then the doctor actually sees it on the screen and can use it to either prompt himself in terms of thinking about the patient, or use it to automatically code the patient with ICD-10 codes and SNOMED codes. Let's move a little bit closer to where we are today. And actually, we have Dr. Nilsson in the crowd here with us from AMS, or Advanced Medical Support. Advanced Medical Support is one of our newest partners. They're based out of Norway, and they're led by Gerd and Trude. And they have a vision of connecting patient-facing applications like symptom checkers and health bots to a back-end medical call center, which allows them to integrate through sort of a multi-channel interface and provide the best patient care. And then coordinate things like specialists, doctors, nurses, transport to make certain that patients get the best care, patients get timely care, and that the system perhaps saves money at the same time. I'm actually going to show you a symptom checker application that uses Norwegian. And as we talked about before, there's a beginning, there's a middle, and the end. And we're going to see this on the screen. There's a beginning where we're going to capture a chief complaint. In this case, I think it's diarrhea. There's a middle where we're going to ask a few questions. And then there's an end in which we provide additional information to the patient. Let's see if I can get this to go. So this is a 25-year-old male. We're going to hit the next button. We're going to enter some symptoms here. And since I don't speak Norwegian, hopefully this reads correctly to everybody in the audience. And it says diarrhea, and then the magesmerter, which I believe means stomach pain or abdominal pain. And just like a doctor, we're going to say, well, what is bothering you the most? And we're going to say it's diarrhea. And here we're seeing that this is all delivered through a web service, and so this is actually an API call. And we're going to ask some questions just like a doctor would. How bad is the diarrhea? And the diarrhea is moderate. How long have you had it for? About 2 days. Is it getting better or is it getting worse? It's staying the same. Tell me about the stomach pain. Well, the stomach pain has actually gotten better. It's gone away. And what other symptoms do you have? Well, I have been traveling recently out of the country, so I think I better put yes to that one. I've not been in the hospital recently. And is there anything else that I want to add on this encounter here? I've got no fever. There's been no blood in my stool. I'm not vomiting. I think I'm doing a pretty good job of reading the Norwegian. So now we're going to take this information, which is actually data, and we're going to pass it into our application. And the first thing we're going to do is we're going to pass it into our diagnosis engine using a method called getCauses. And this method lists a series of causes based on descending order of likelihood. And then we also have a triage capability, which makes a recommendation in terms of when you should see the doctor and the urgency of care. And this is based, again, on 20 years of work with millions of patients to get to this curated outcome. And then we also have care advice that's built into this engine as well, in terms of providing care advice to the patients. We're going to move away from Norway, and we're actually going to move down to Israel and talk about a company called Untitled. And this is a company that would be great to present here because they're doing some interesting work in the area of medical devices. And they've developed a set of medical devices which are FDA approved in the United States, and they fit into a small bag, and a patient can actually use these at home to perform an examination. So think about going to your doctor. Well, when you go to your doctor, the doctor's going to ask you questions. But what's missing from a lot of telemedicine encounters? Well, the examination is what's missing. And so what they've provided is a telemedicine way to capture some key exam elements. Now, the thing that we're helping them with is knowledge engineering, because they've got a device which can look in the ear, look in the eyes, take a picture of the throat, listen to your lungs, listen to your heart. It can do all those different things, check your temperature, check your oxygen level. But which device should a patient use for certain symptoms? And so using our natural language processing engine, they actually identify the correct chief complaints, and then using our tell us more questions, we ask the patient some more questions, and then we actually give a list to Untitled about which devices are appropriate for those combinations of symptoms. They actually show them to them on the computer screen or on the iPhone, and the phone actually talks them through it in terms of what they're supposed to do. So at the end of the encounter, what happens is the Untitled device, which is actually now based out of your iPhone, has history that you've provided in terms of information. It's got pictures that you've actually uploaded through your devices, and it sends that combination of information in an encrypted manner onto the patient's doctor for telemedicine care, saving sometimes a visit to the ER or even a visit to the doctor's office, because you can talk with your doctor directly over the internet. This is getting towards the last part of our presentation, and the content that we've talked about is really, it's really user interface agnostic. And so we've got partners that are working in the web environment with native apps. We've got partners that are working with health bots. And here's a partner that's actually developed an Alexa voice app using our content. They tell me that they did this with a single programmer in 6 to 8 weeks. So let's listen and see what happens.
Alexa, open Health Navigator.
Hello, Peggy. Tell me about the symptoms or problems that are troubling you the most. Use your own words.
It hurts when I urinate, and I'm urinating a lot.
Let's first talk about the urination pain. How much does it hurt? Tell me on a scale of 0 to 10.
5.
When did this happen or start? How long has this been going on?
2 days ago?
How do you feel? Is it getting better or worse? Or staying the same?
It's about the same.
Okay, I am going to ask you a number of important questions. Your answers will help me give you the best advice and health information. Are you having pain in any of these areas? Abdomen or stomach pain, back pain, flank pain?
No.
Do you have any of these symptoms? Blood in urine, chills, fever, urination frequency?
Urination frequency.
Do you have any of these symptoms? Urine unusual color, urine incontinence, urine retention, vaginal discharge?
No.
Do you have any of these symptoms? Vomiting?
No.
Based on your responses, it does not seem you need emergency care. Most people with similar symptoms can safely make an appointment to see their doctor. You should see your doctor today or tomorrow, or talk to your doctor within 24 hours.
Okay, Alexa, call the health clinic.
Alexa, start Health Navigator.
Hello, Mike. Tell me about the symptoms or problems that are troubling you the most. Use your own words. Please tell me about your condition.
I started vomiting this morning and I have a sore throat.
Which one is bothering you the most between vomiting and throat pain?
Vomiting.
How many times have you vomited?
4.
How long has this been going on?
6 hours.
How do you feel? Is it getting better or worse? Or staying the same?
I think it's getting worse.
How bad is your throat pain? How much does it hurt? Tell me on a scale of 0 to 10.
3.
Okay. I am going to ask you a number of important questions. Your answers will help me give you the best advice and health information. Do you have an injury to any of these areas? Head injury, stomach injury?
No.
Do you have any of these symptoms? Confused, cough, diarrhea, dizziness?
Dizziness.
Do you have any of these symptoms? Spinning, tilting feeling, stool black color, trouble breathing, urination pain?
I'm having trouble breathing.
Do you have any of these symptoms? Vomit looks like coffee grounds, vomiting bile, vomiting blood, weakness all over?
No.
Do you have any of these medical problems or conditions? Diabetes mellitus, HIV positive or AIDS, weak immune system?
Diabetes.
I'm sorry. This could be quite serious. People with similar symptoms usually need emergency care. Go to a nearby emergency department, ER, right now.
Alexa, ask Health Navigator. My son has a...
Okay, thank you for watching that. The last vignette with this 5-year-old who's super cute, but in the interest of time, we're going to move on past this. And for those of you that are physicians in the audience, of course, that last case was a case of diabetic ketoacidosis, right? Where you have a young man who's on insulin, who's got diabetes, who now has some shortness of breath and feels dizzy and has been vomiting. So it's a classic presentation for DKA or diabetic ketoacidosis. The point of this is not to replace a doctor. The point is to provide medical care that's better, faster, and cheaper, and to somehow get patients to their doctors as quickly as possible, and to capture that information and then move it onto the doctor. How can we make medical care more consumer-centric and patient-focused? I'm going to wrap up here now, and as part of my wrap-up, I'm just going to reiterate that what we do is we provide health information content. We deliver it through web services so that our partners can build cool tools that improve the patient and provider experience. And today, during this presentation, we talked about a number of different things. We talked about our clinical vocabulary and the importance of having that to be able to make artificial intelligence possible. You need to have the words and the data to be able to talk to patients and transmit information between patients and doctors. We talked a little bit about natural language processing, so we can actually convert free text. We talked about decision support, which needs to be curated and researched using large data sets. We talked about an omni-channel approach, and specifically we showed a web version, a health bot version, and even an Alexa version of this. We talked about delivering content through an API, documentation support for patients and doctors, a multilingual approach, and the fact that we come from a very long background in doing this sort of thing. This has truly been a pleasure speaking with you today and sharing with you some of the great things that our partners are doing across the country and across the world. And if you'd like to learn more, just come by, and I'll be standing here after the conference, and I'd love to chat with you. Have a great day.